So I think there's several ways to approach that question. I think current screening guidelines focus on the group of men aged about 55 to 69 or so as kind of the prime screening age men. And that's a population that the clinical trials of PSA screening has really focused on. And we think, that's the age where men are at a high risk of developing prostate cancer relative to younger men. Yet they aren't elderly enough that competing mortality risks become a major issue. And therefore, the rates of it's thought that the rates of overdiagnosis or detecting cancer on screening that never would have been diagnosed in the patient's remaining lifetime, that patients older than 70, that may be a much bigger issue than for men kind of in that 55 to 69 age range. So I think overall, and I think modeling studies have supported this. I think focusing screening on that age group is reasonable. There is a thought that men at high risk, so men with a strong family history of prostate cancer, or Black men, for example, who have a higher baseline incidence of prostate cancer and metastatic prostate cancer, that it may make sense to start screening earlier for those men, maybe in their 40s instead of their 50s. And I think there's many potential caveats and concerns about that. I think there are some modeling studies, again, that support that approach. At the same time, taking Black men as an example here, Black men were largely excluded from the major PSA screening trials, not necessarily intentionally, but they just weren't well represented on those trials. Yet we know that their epidemiology is quite different. So we actually don't have a good estimate of the efficacy of PSA screening among Black men. And we also don't have a good estimate of the screening related harms among Black men as well, especially young Black men. And I think that same caveat can be applied towards other high risk groups, men with a strong family history of prostate cancer, for example. So I think it's certainly common to start screening those high risk men at an earlier age, and I think that's a reasonable approach based on the available evidence in the modeling studies that have been done. But I think there's certainly some unanswered questions of whether in that younger age group, whether the benefits of screening truly outweigh the risks of overdiagnosis and screening-related harm. So I think overall, I don't have a clear answer for you because I think we need more evidence. And so with our work in the VA system, we're interested in trying to generate some of that evidence going forward in the absence of new randomized clinical trial data.